Hi friends. We know that our exams are coming up next week, so we set up a quiz on Addison's disease. So let's see who is ready for the exam next week. We have question number 1. It says Addison's disease is A. Increased secretion of cortisol, B. Increased secretion of aldosterone and cortisol, C. Increased secretion of cortisol, and D. Decreased secretion of aldosterone and cortisol. I'll leave you to answer that.
Number 1 is decreased secretion of aldosterone and cortisols.
Correct. Number 2 question says, which of these options is a diagnosis test for Addison's disease? A. Sputum test, B. ECG, C. Synactin test, and D. Spirometry.
Number 2 is C. Synactin test.
That is correct. Number 3 says the role of cortisol in the body includes decreasing the blood sugar and inhibiting fat and carb production. B. Synthesizing protein and increasing carb excretion. C. Elevating the blood pressure and maintaining ADH. D. Increasing blood pressure level, increasing blood glucose level, and breaking down fat, protein, and carbs.
Number 3 is increasing blood glucose level and bringing down fat, protein, and carb.
That is correct. Number 4 says now, the nurse is planning care for a 52-year-old male client in acute Addison crisis. Which nursing diagnosis should receive the highest priority? Number 1, risk for infection. Number 2, decreased cardiac output. 3, impaired physical mobility. And 4, imbalanced nutrition, less than body requirements.
And the answer for number 4 is decreased cardiac output.
That is correct. Number 5 says, characteristics of diseases are the following except chronic worsening fatigue, B, purpose try, C, loss of appetite, and D, hyperpigmentation.
5 is purple strain.
You are very correct. Let's go to number 6 question, which says, which of the following patient is most at risk for developing Addison's crisis? A patient who is post-operation day 2 from thyroid surgery. B, a patient who is post-operation day 2 from an adrenalectomy. C, a patient with Addison's disease who reports taking prednisone regularly. And D, a patient who is having gastrointestinal surgery.
Number 6 is B, a patient who is post-op day 2 from an adrenalectomy.
You are correct. Number 7 question says, which of the following below is not a sign or symptom of Addison's crisis? A, low blood pressure. B, severe pain in the stomach, leg, and lower back. C, hypokalemia. And D, hyperthermia.
Number 7 is C, hyperkalemia.
Wow, you are indeed ready for this exam. That is very correct. Number 8 question says the dash secretes ACTH, which causes the dash to produce cortisol. A, hypothalamus and adrenal medulla. B, thalamus, pituitary gland. C, pituitary gland, adrenal cortex. And D, adrenal cortex, pituitary gland.
Answer to number 8 is C, pituitary gland and adrenal cortex.
Wow, that is definitely correct. Now let's go to the last question for today. Number 9 says, which of the following is a nursing priority when caring for a patient with Addison's crisis? A, administering IV solucotriphyl. B, checking blood glucose. C, monitoring low urine specific gravity. And D, elevating the head of the bed.
Answer to number 9 is A, administering IV solucotriphyl.
Wow, Jessica, you are indeed very ready for this exam. Okay, friends, Jessica is ready for this exam. Are you ready for the exam next week, Tuesday? All right. We hope you enjoyed this quiz just like we did, and hope that everyone, we wish everyone success in their exam next week. Thank you for watching.